Questions? Gentlemen in the back there, stand up, please.
What would happen if the Republicans were to succeed in repealing the Health Care Reform Act?
Questions? What would be the consequences if Republicans succeed in repealing the Health Care Act? Who wants to take a stab at that first?
I may have said, and some in this room may have heard me say in the past, that casting that vote for the Affordable Care Act was one of the proudest votes I've ever cast in the House of Representatives in the time that I have spent there. I was not there for Medicare or Social Security, but I was there for the Affordable Care Act, and I believe it has the ability to transform health care in this nation. In several ways. The purpose of the bill was to make health insurance affordable for people who have health insurance and for those who do not have it but who need it. That was the crux of the bill. There are already a number of pieces that are in place that have been implemented. If you move to repeal, we go back to a situation where there are lifetime limits from insurance companies, annual caps. I talked about gender rating. Women pay 48% more for health care just being a woman. That ends. Let's take the piece on pre-existing condition. And let me start with children. Today, right now, son, daughter has a diabetes, asthma, autism. Insurance companies can no longer discriminate and say they will not insure your child. Okay. Kids up to age 26 can now be on their parents' health insurance. According to the Hartford Courant, New Haven Register, that has brought down the number of uninsured already in our state and in the nation. So working well, those pieces would get repealed. We would go back to saying no for a pre-existing condition. Seniors, I'm going to get to women last. Seniors, donut hole, prescription drugs. Working to close that donut hole. That is, if you don't know, some of you do know about it, up to about $2,900. You share the cost between $2,900 and $4,900. The cost is you bear it on your own. There is no kind of a copay. What we have done in the bill is to say, right now, on brand name drugs, seniors can get a 50% rebate. On generic drugs, a 93% rebate. We are closing the donut hole, bringing prescription drug costs down. That would get repealed along with preventive care, screenings, mammography, colonoscopies, all the wellness exams. All of that today is now without cost, no co-pay for seniors. We would revert back to having them have to pay. Last point I would make to you is women. I said 48% more, it's over. Secondly, pre-existing condition again. Women have been denied health care coverage because of a cesarean section childbirth or because of being a victim of violence against women. I've said no. We now have, as well, a battery of preventive services, not determined, I might add, by 535 members of the Congress, House and Senate, but we asked in terms of preventive services. We said to the Institute of Medicine, lay out what would be good preventive care help for women, to give women a good quality of health care. And they came back with several. Again, cancer screenings, the human papilloma virus, which is a link to cervical cancer screening, well women visits, gestational diabetes, counseling for HIV and other kinds of counseling, and yes, contraceptive services. They said these would be good quality healthcare initiatives to keep women healthy. Small businesses today can now get a 35% tax subsidy if they choose to insure. 50 or less if you have it as an employee, you do not have to provide insurance. But if you do, you can get a 35% tax cut subsidy right now. 2014, you can get a 50% subsidy in order to do that. We will not no longer, it's unbelievable what is in this bill and what they would intend to repeal. Today, insurance companies are mandated to spend 80% of the premium that you pay for your health care, not for administrative costs. Many of you may have received a rebate check because 137,000 people in Connecticut did get a rebate check because the insurance company was not paying 80% on health care today. All of that. You know, we have voted 31 times in the House of Representatives to repeal the Affordable Care Act. The House passed it, the Senate passed it, the Supreme Court said it was constitutional. Our job now is to implement it, to allow for what changes need to be made, to strengthen it, and to make sure that we are providing, and people in this nation are getting health insurance they can afford in order to safeguard their health and their families' health.
Yeah.
I would vote to repeal the Affordable Care Act, and I'll tell you why. Basic, simple reasons in my heart. Number one, I do not believe that the federal government should ever, under any circumstances, be granted the power to tell the American people that they must purchase or not purchase a product, even if the product is a good one. The idea of health care for everyone is actually a good idea. I have no problem with that. I do have a problem with the overreaching of government because today it's something that we all can agree on is a pretty good thing, health care. Well, what the Supreme Court actually ruled was that basically the government can now impose sanctions on us to do anything as long as they call it a tax. The other thing is that I do not believe that the government should be in the business of running health care. Government, quite honestly, by its design, isn't really good at running a whole lot of things. And as someone who has actually had to use the safety net, I believe I have a better perspective of what it does and doesn't do. I'll put it to you this way. Who can better tell you whether or not a car is a piece of junk? The person who sold it to you or the person who has to drive it to work every day? I submit to you the person that has to drive it to work every day. Here's what I mean. Last year, I was diagnosed with prostate cancer. The only reason that I'm standing in front of you right now is because my doctor, by the way, in my bio, you know I've had several different jobs during the course of my working life. Well, wouldn't you know, I waited until the one time in my life where I didn't have health insurance to get cancer. You would think my timing would be better. So, I was forced to use and had to rely on the state health care system, the Husky plan. Well, first of all, the only reason my cancer was detected is because my primary care looked at me and asked a question. He said, Wayne, how old are you? I was 47. I said, well, you know, you're kind of young, but you know, we usually don't do the PSA blood screening for prostate cancer until 50, but would you like to take an early look? I said, sure. Well, because of that early look, I was diagnosed not just with prostate cancer, but it was actually very aggressive. When I got my biopsy in May 17th of 2011, it was rated 5. When I had my surgery, September 22nd, it had progressed to a 7. And was right at the edges where it was going to jump from the prostate to the rest of my body. Now, here's the thing. In the Affordable Care Act, that screening, which saved my life, is rated a D. Services are rated A through D as far as whether or not they should be, whether it's recommended that they continue to be covered, etc. Well, that test going forward, unless the rating is changed, will be either discouraged or discontinued. That will result in a larger number of deaths for men from prostate cancer, and in particular, African American men, because prostate cancer is more aggressive and more prevalent in African American men. Just a fact. So that's one thing. The other thing is this. I would rather get the care that my doctor recommends rather than what the government says they'll pay for any day. Because of my age and my overall health, my doctor recommended the robotic surgery for me. It's the latest treatment. The recuperative time is very short. However, the state doesn't pay for that. Pay for the regular scalpel surgery, which you won't die, but it's not necessarily what your doctor recommends. I was able to get what my doctor recommended because my surgeon opted to take the financial hit and go ahead and do the surgery anyway, because he made enough money in the private sector that he could do that from time to time. I realized that I was uniquely blessed. There are many millions of people that don't have that situation. I believe fundamentally that the doctor-patient relationship should be respected. And I just do not believe that the government should be making our healthcare decisions based on cost. The other thing is this. Services will be basically scaled down according to how they're paid for. The other thing is each state is required to set up a healthcare exchange in order to provide insurance and services for people. If the states do not or cannot afford to set up an exchange, well, then it defaults to the federal government. Well, let's take Connecticut, for example. We already have a deficit of how many hundreds of millions of dollars? I don't see Connecticut as one of those states that will be rushing to set up an exchange and that will default to the federal government. There's no incentive for states to actually do it. The result, long-term, will be that the government's running our health care. I disagree.